Hi, I'm Chantel Cohen, and I am here to demystify couples therapy. And I just want to talk a little bit about what I do in couples therapy. So, and believe it or not, we also do this with individuals as well. But I'm going to use the example with the couple. So one of the things that we start to do is we talk about what the issue is and what that couple wants. And I'll tell you a little secret is 99.9% of people, even if they don't argue, they have disagreements, and those disagreements are perpetual. Some are bigger than others. So if we've got a couple that is really big, meaning there's lots of yelling and slamming doors and so forth, the first thing I want to do is to de-escalate them. So even when they're talking to one another, and one of the things I do is I look to see if they can talk to one another. And usually that's pretty difficult. And so one person will like roll their eyes, or they'll do something and they'll say, here you go again. And so I look at that and I start noticing what the triggers are in the relationship, what triggers each of them. Because what triggers one is now if one person rolls their eyes, and now the other one starts to raise their voice because they've been triggered. As this person raises their voice, the other one rolls their eyes and may even move their neck, put their hand on their hip. So you can see how it has an escalating quality to it. So it's really up to me to start to identify what are the triggers. And then once that person's been triggered, what do they do in response? Because that's going to be really important that I disrupt that. So we're processing feelings and talking about feelings, but I'm also trying to look at the underlying sorts of processes that keep them in dysfunction, if you will. So that's an argument cycle where they're triggering the heck out of each other. And so when I'm trying to de-escalate them, I will start to lower my voice. So it sounds like, if I'm seeing this correctly, that when she just raised her voice, that caused you just to shut down. What was happening for you inside when you started to shut down? So I'm starting to ask about that person who shut down, their internal dialogue, what's happening. Because what their partner sees is them shutting down, and they're like thinking they don't care. They don't really care about me at all. Look, you know what? Whenever I get upset, she just freezes me out, and now it's like talking to a wall and I'm left all alone. But once I open this other person up and they start talking about what's happening inside, well, I don't want to make it bad. I don't want to make it worse. And I've got all these feelings. I start to feel flooded. I don't know if I'm going to say the wrong thing. And so sometimes I just feel like I'm going to make it worse. And their partner gets to hear that. And I might unpack that a little bit with them and say things like, well, gosh, that sounds like you really are trying to prevent an argument. And yet you're not knowing what to say to move forward. And so their partner gets to see the dilemma that they really do want to talk about it, but they don't know what to say. That's different than freezing that person out. And so now the person who feels alone and frozen out gets to hear that their partner really wants to do something about it, but doesn't know what to do. And so now they start to align and feel like they're on the same page. Now, obviously, it takes more iterations of me sort of helping them unpack their experience, but I also do something with my voice. I model. I get them to talk about, well, what's it like when you're flooded? And so then we start talking about emotions, because I know sometimes you don't know what you're feeling. And I might say something like, can I help you with a little bit of that? And tell me if I'm off the mark on this. And sometimes I'll say something, and that person will say, if I'll say, are you frustrated? No, I'm not frustrated. What I'm really feeling is dismissed. So sometimes even me just helping them, even if I'm wrong, it sort of triggers something in them to say, no, it's more like this. So we start getting a clearer picture of the emotions, what they're thinking to themselves. I feel dismissed. I feel overwhelmed. and I'm worried about saying something wrong, but I really want to make this better with my partner. And so now we start to see a little bit of de-escalation, because now there's more to work with. Before, this other person was just seeing their partner shut down on them, and they were thinking they don't care, I'm left all alone, I'm the only one trying in the relationship. So as we start to unpack, they start to de-escalate, and then I start asking them to turn to one another once they get comfortable. Can you talk about those emotions, those times when you just shut down? Can you share a little bit more about that? Can you give me examples of that? And they might say, well, there was this time, and their partner will say, yeah, I remember that. And I'll say, gosh, as we're learning more and more, what's coming up? Well, gosh, there were some things that I didn't even really realize I was feeling back then. And they start talking to their partner. And I have the partner model things like listening, not interrupting. And if they do interrupt, I might say, it feels like maybe you're triggered. I see you interrupting. Is this what happens when you argue? So that I get them to pay attention to what they're doing. So every movie you see, it's like, they talk about, oh, I'm in such anguish. And then the therapist says, and somehow they're healed from that and it all works out. It doesn't really work that way. There really is a system and a strategy behind all of it. And so as couples really get some facility and they start to understand why they're triggered, I start giving them things to say, so that they're not using the same sorts of behavioral patterns or phrases that used to trigger their partner. Now they're using things that are going to invite their partner in to their emotional experience, so that they can start to communicate in a way that bridges each of their styles and gets them feeling really connected. I hope that this demystifies a little bit of couples therapy. Guys, it's not this awful process. It really is personal training for your relationship. I'm Chantel Cohen, and I help you become one again. Please, if you're watching this on YouTube, please hit the subscribe button. We have lots and lots of videos. Also, if you're on Instagram or Facebook, please follow us.